The RIGHT study is the Research on Immigrant Health and State Policy study. It has been a multi-year study funded by the National Institutes of Health to understand how immigrants, particularly Latino and Asian immigrants here in California, experience their policy environment. The Center for Health Policy Research is the home of the RIGHT study. Some of our investigators are based here at UCLA, also at UC Merced and UCSF. The RIGHT study came out of some of the work that Dr. Steve Wallace, Dr. Purat, and I had been doing for several years, really trying to look at the links between the policies that we have in the US at the federal and state level that shape the lives of immigrants. There's a lot of policies in both states and at the national level that determine the types of rights that immigrants can have based on their legal status. So things like access to healthcare, ability to get a driver's license, the right to pay in-state tuition, to go to university. These are all things that are set by public policies. And there's a lot of evidence that those policies have an impact on health, but we really didn't know how or kind of what happens when a state, for example, passes a policy, sort of what actually happens on the ground, what happens in people's day-to-day lives. The survey that we conducted included anybody who was born in Latin America and anybody who was born in Asia, with the exception of the Middle East.
The RIGHT study is a mixed method study. It includes both qualitative in-depth interviews, and then it's a follow-back study, which means that we surveyed participants that are part of the California Health Interview Survey.
One part of the study was to conduct a phone survey of 2,000 Latino and Asian immigrants. On the other side, though, we wanted to capture the more rich nuances of people's day-to-day lives, and so we did a qualitative in-depth interview portion with a smaller sample of about 60 total Mexican and Chinese immigrants living in Southern California. And so we wanted to make sure that we had diverse experiences, not treating policy as something that exclusively affects one ethnic group. It's something that affects all immigrants living in the US.
I think a really innovative piece of the study is that we, as a group, developed policy indicators to actually try to understand the experience of immigrants across different policies.
Immigrants have a voice and they want to be heard in policy solutions that would influence their health. And they're also suggesting these policies from a place of wanting to be seen for who they are and the contributions that they can give to their community, rather than being seen as a lot of these exclusionary narratives or criminal narratives that identify immigrants as economic threats or drains.
We looked at perceptions of safety, whether or not immigrants are concerned about safety issues. And we did find that if they were concerned about safety, they may have gone to the doctor less often, or they may have, they were less likely to have a usual source of care. We also looked at perceptions of discrimination.
We found in the RIGHT study in our survey that immigrants had seen immigration authorities in their neighborhoods. They had actually made choices to stay indoors to avoid or because of fear of immigration. People had been racially profiled in public spaces or while driving. And also people themselves, we had interviewed some people who had been deported and many people who knew somebody who had been deported. And we found that altogether, having those experiences had a detrimental impact on people's physical and mental health, and also created barriers for them to get the healthcare that they needed.
One thing that we found in our study is that employment plays such a huge part of shaping health for Latinx and Asians, especially because just the way that the US healthcare system is set up. Employer-based insurance is the dominant form of insurance. And so we really found that it was kind of a main way that people would have health insurance or not.
This is what our study found, the interaction relationship between several policy sectors, for example, the enforcement sector and also the public health or public policy.
When we think about immigrant health, we can't only think about immigration policy or health policy. We have to think about how they interact with these other sectors. This study in particular really can give a lot of insight into how we can put all these policies together in a way that can really help include immigrants in society a lot better.